Sally Lyles, and I'm going to be performing my HEENT assessment today on my coworker here. I'm going to wash my hands. I'm going to observe the general appearance of my patient, and she looks all put together, dressed appropriately for the season, and hygiene is all good. So next I'm going to look at her skin and at the color. She is pink, and her skin is intact in all places and dry as well. How are you feeling today?
Good.
Good, okay. Her affect has been appropriate with me as well, and her mood and speech are all within tact and what I would expect to see. Have you had any problems with your eating habits lately?
No.
Your nutrition? Okay, that's good. Okay, next I'm going to start with her head and face. I'm going to observe her eye contact. She's been looking at me as I'm talking to her and asking questions, and that's good. And can you tell me what your full name is?
Yes, Marissa Smith.
Okay, and when is your date of birth?
11/5/85.
Okay, who's the president?
Obama.
Okay, so level of consciousness is intact. Next I'm going to observe her head, and I'm just going to place my hands on her scalp and feel her scalp for any abnormalities or inflammation or anything. It all is good and intact. Our hair is intact and looks good as well, no breakage or dryness. Can you smile for me? Okay, that's good. Stick out your tongue. Go back. Okay. So her facial is symmetrical. I'm going to feel her temporal arteries. And I'll also feel her sinus passages. Do you have any pressure or pain with that? Next, I'm going to feel her maxillary, or her temporomandibular joint. So, press here and just open and close your mouth a couple of times. Okay, that's intact and no issues or grinding or popping with that. Next, I'm going to move to her eyes, and I'm going to do the peripheral vision test. So I'm just going to have my hands out, and I want you to tell me when you can see them.
Okay. I can see them.
Okay?
I can see them.
All right, good.
I can see them.
Okay, good. Thank you. No issues with that as well. Next, I'm going to look at her corneal light reflexes. Excuse me. I'm going to use my otoscope light here. Just shine it in her eye. Can you look straight there?
You wouldn't think that leaning over a lot yesterday.
Her pupil dilates correctly.
In the back of my head.
Good job. Thank you. Okay, and then next I would do, I don't have the correct tool for the red reflex, but I would just, in order to do that, I would get the equipment and I would look into it and look into her eye and shine the light and just gradually get closer and look for that red color of the eye. Okay, so the next thing I'm going to do is the cover test. So can you cover one eye for me? Okay, and then when she uncovers her eye, I'm going to look for if she has a gaze at all, and if she did have a gaze, then her eye would go back to the normal position. Okay, uncover your eye. Okay, no gaze noted. Cover your other eye. Okay, uncover. Okay, no gaze noted on that one as well. Okay, so the next thing, I'm going to inspect her eyes. I'm just going to look at the general structure of them, which they look good. The sclera, they're white with no discoloring of her eyes. eyelids, iris, pupils, everything looks to be correct, and I'll perform Perla just to make sure that it is correct. It's about the same test as the
Popped up clean. Yeah, as soon as Marissa gets back.
pupils are reactive to light and equal. And so the Snellen test, if I were to perform it, I actually printed off what it would kind of look like, and it looks like this. And you would just start from the top and have your patient read down from there to see what their vision was. Okay, next I'm going to inspect the external ear and just look at her ears, and I don't note any damaging or broken skin or swelling. Do you have any pain when I push here? Okay. Do the same for the other side. Any pain?
No.
Okay. Ears look good. So now I'm going to look inside of her ear and do the look in the tympanic membrane also. Okay, looks good to me. I'm gonna look at the other side. Looks good. No abnormal changes noted. So now I'm going to do the whisper test. Can you close off one of your ears? Okay.
Okay.
Tell me what
As soon as she's finished what she's doing, she'll take her.
Yes.
What did I say?
Facebook.
Okay. Alright, do the other side. What did I say?
Apple.
Okay. Good job. Alright. So, next we're going to move to the nose. I'm just going to look at her nose and inspect for any lesions or abnormal findings, and I don't see any. And then I'm going to test her patency of her nostrils, and can you close off one side and sniff? Okay, close off the other side. Okay, the nostrils are patent. Next I'm going to move on to the mouth and throat. Can you just open your mouth for me? Looks good. I'm going to grab a glove over here and just stick my hand in to see if I feel any abnormalities in her cheeks. Okay. And then also just look at all of her mucosa. Everything is pink, moist, and intact in her mouth. Can you hold up your tongue for me so I can look at the bottom? Okay. And that looks good as well. Okay, so, and then earlier I had her stick out her tongue and do all the reflexes, and they were all intact. I will ask you to stick out your tongue and say ah. Okay, that looks good as well. So next I'm going to look at the neck. Just going to palpate your neck and feel for any mouses or lesions. Also just feel for her different lymph nodes here.
Did you have chemo then?
Also feel for trachea, and then just gonna come behind and feel for her thyroid gland, which I can feel. And it's all good and intact. I'm gonna check your carotid pulse. And no issues there as well. Okay, so next I'm going to check your range of motion. Can you just lift your hands up? Okay, and then put your palms up, close your eyes. Okay, and that's good. Alright. Alright, that includes my HEENT assessment. Thank you.